Many women are becoming more open when it comes to talking about their bodies and health, and that's a good thing. But there are a few topics we're still reluctant to talk about. So today, with the help of our friend, Dr. Anne-Therese Stubbs of Anne-Therese Aesthetic Medicine, we are going to tackle some of these topics and learn how one treatment can help with them all. Welcome, Dr. Stubbs.
Nice to see you.
Okay, so let's start by talking about the problems. First is bladder control. How common is this for women?
It's called stress incontinence, and for women it's very common after pregnancy. A lot of the female structures loosen up with time and with age, and especially after having a few babies. And so a lot of times women will find they need to cross their legs when they cough hard, when they sneeze, maybe when they laugh. A lot of women say that after they've had a few pregnancies, they can't jump on the trampoline with their kids without having to run to the restroom. They can't do exercise classes, aerobics classes, maybe jump up and down, jump rope. The trainer says grab the jump rope and they roll their eyes like, oh, that's not going to work. So we have a wonderful new treatment for that that's non-invasive, that's not surgical, and that can be done in about a half an hour. It tightens up all the female structures, so women who suffer from stress incontinence are loving this.
Now, when do we know it's a problem? Is that based on the frequency of these leaking episodes?
I'm saying that any woman will know it's a problem if it's interrupting her daily life, if it's something that she feels that she has to wear a pad every day just to kind of get through the day and not have little accidents. And I think it's more common than most people know about, because women don't tend to talk about it very much.
Now let's talk about another intimate issue with women. Vaginal laxity, vaginal dryness. How common are these problems?
Very common perimenopausal. So if women are around the menopause years or right after menopause, the estrogen just isn't there anymore, and so the whole area changes. Everybody doesn't have the same moisture level that they used to when they were young. This can make for difficult sexual encounters. Dyspareunia is what it's called, but it's basically painful sex. And a lot of people just feel that clothing doesn't fit quite right either. They have some laxity in the whole female genital area, and they don't like the way clothing fits or the way exercise clothes fit, because they just feel like that whole area is very different after menopause. And so this treatment, Thermiva, tightens all those structures.
And are these three issues all related?
They
all
are.
Tied in?
They are. It's just it basically, with aging, our hormone levels change, and we get some laxity in that area. We get some looseness, and women also get a lack of moisture down there for just, it's part of aging, and so that's one of the things we try to fight.
You mentioned the solution. Tell us more about it and how it helps.
Thermiva is a brand new, recently FDA approved treatment that's non-invasive. It's radiofrequency. So radiofrequency heats up skin. We've long used it on the face for tightening jowls, but basically now we're using it in the genital area. It's an external treatment, and then within the vaginal canal, it's just some heat. It's very comfortable. Women say it's not uncomfortable at all. It's just a little bit of heat. It remodels collagen, so it produces your collagen, more tightening in the area, and increases moisture as well.
And is this a treatment we can do right in office, right in the privacy of your own office?
Yes, we do a consultation and make sure there's no reason, no contraindications to it, and then we can perform the procedure in about 30 minutes.
You mentioned not invasive.
Not invasive at all. There's no needles, there's no breaking of the skin. It's just a little bit of gel on the external structures and a little wand that heats the external structures. And then intravaginally, just like women are used to having pelvic exams, and you know, especially with babies, we've all been through a million pelvic exams, and it's something we should do every year for our health anyway. A pap smear, it's less uncomfortable than a pap smear.
How long do the results last?
They last about a year. We do one treatment for 3 months in a row, and then women are comfortable with everything for usually about a year. We usually recommend a touch-up once a year thereafter. Some people make it 18 months with all the tightening, and then they start to see that they need another one.
All right, so with so many women suffering from these relatively common conditions, you want to help them learn more. Tell us about the upcoming Sunday brunch.
We are going to have a brunch at the end of January after everybody's calmed down from the holidays, and we just invite women in for a champagne brunch to talk about this, to see the machine, to basically talk a little bit more about it. I think this is a very delicate topic, and a lot of women don't want to talk about it you know, in a too public a forum, and especially they want to just be around women.
Sure.
Other women who've maybe gone through the procedure can talk about it and say, yes, this is how I felt, this is how it improved my life, and just kind of give it a forum where women can ask questions and have a little champagne brunch with us and learn a little bit more about it.
Very nice. Dr. Stubbs, thank you so much.
Thanks for having me.